Hey guys, hi there, Dr. Davin Lin, board certified laser dermatologist. Today we'll be talking about Botox and the off-label indications, so the indications that you may not know what Botox can be used for. So in Australia, we have three different types of Botox. Botox, the original Botox by Allergan, that's the most expensive. Then you have something called Dysport, which is the second most expensive. And just this year we've got something called Xeomin, which is also a form of botulinum toxin, and this is the least expensive. Okay, so we all know that Botox can treat wrinkles, forehead lines, crow's feet, and yeah, basically even glabellar lines like this. So these are the standard applications of Botox, but what else can we use Botox for? Well, for me, the second most common use of Botox is to actually treat underarm sweating or axillary hyperhidrosis. Now, this is subsidized in Australia only by specialists, and we have to use Botox. We can't use anything else but Botox. So the treatment itself takes about a minute to do, and it lasts for up to 6 months. Okay, guys, you can't see my shorts, can you? No. Okay, guys, we're going to do Botox for axillary hyperhidrosis. Now, this is how we define the follicular outline. In other words, where we inject market. So it's basically this area here. And look at this. The maximal area of sweating normally is in the crease line, but if I were to mark it, we'll go an area like that. So that's the tail. Most of the Botox will be placed in this area here. Okay? So I'm very, very good with this. We're placing 50 units of Botox into each axilla. So I'm going very superficial. Guys, it's really important to go really superficial. And how much will we place? Basically, it's due to experience. We place it approximately 1.5 centimeters to 2 centimeters apart. And you can see how quickly I'm going here. And it's very, very superficial injections. Superficial injections of Botox. My dilution is actually each axilla, so each armpit gets 50 units of Botox. So under Medicare law, you've got to actually put 50 units of Botox. It can't be Dysport, it can't be Xeomin, it's got to actually be Botox. And you can see the majority of my Botox injections are in the crease line. So lots in the crease line there. We're nearly finished. How's everything going?
Yeah, it's fine.
Yeah, it's fine. Okay, so that's a follicular outline there, and we're nearly done. I'm not as quick as Steve Weiner. I think he holds a record of 30 seconds, but he's using a 5 injection needle. So Steve, you got me on this. You're cheating. You're using 5 or 6 injections. I'm only using 1. So that should be, I think, about 1 minute, 1 and a bit minutes. Now, this will take effect in about usually a week or so, and it should last generally about 4 months for first timers. Push up to about 6.2 months on average. So we've got some users who actually last 2 years or so, but that's an exception rather than the rule. In Australia, Medicare absolutely subsidises 3 of these in a minimum of 4 months apart. So it's basically what you're paying for is about less than a cup of coffee to be sweat-free. Thanks for watching, guys. Catch you next time. Bye. Secondly, we can actually treat sweaty hands as well. This is not endorsed by the TGA or PBS. In other words, it's not subsidised in Australia. However, some medical insurance companies do pay for it. Now, one of the best ways to treat sweaty hands with Botox is what Dr. Steve Weiner has done. Dr. Steve Weiner, if you don't know him, he is one of the most innovative plastic surgeons around. He invents new stuff, and he's really cool. He's in Florida in the US, and he's a good friend of mine. So watch this, and it's really, really cool and really quick as to how he actually performs Botox with sweaty hands. Okay, so here we can see what's known as micro Botox. We're using actually a micro injector. So that contains tiny needles, but it contains dozens of tiny needles. And Dr. Weiner is moving really, really quickly. He's using Dysport instead of Botox to keep the cost down. So with this procedure, you can do this under a nerve block. I frequently use a combination of local anesthetic in a glove, ice, and on the nerve block as well. And it's almost painless if you do it this way. And it lasts about 4 months. So an excellent method to treat sweaty hands. Okay, now the third thing which I use Botox for a lot is for facial slimming. that's from an aesthetics point of view. So you've seen my video on facial slimming, but it also helps with TMJ problems, in other words, your jawline problems, whether you get achy jawlines or teeth grinding, and it also can help with headaches. So that's my third indication. Deep injection here. I'll actually get a little bit more posterior here. Deep injection here. Pain-wise, how was that?
It's fine.
It's fine. Yeah, it's not very painful. Botox to the masses, once you put it deep, hurts a lot less compared to aesthetic Botox on the forehead. For me, when I get my Botox, the real killer is right under my eyes. I find that the most painful procedure out. But if you go deep into the muscle, it's actually very tolerable. Okay guys, bad hair day for me, but it's been as you can see, my hair's grown, so it's been about 8 to 9 weeks around there. Yeah, cool.
Yeah, 8 weeks.
So 8 weeks or so. So 8 weeks we've got a good reduction. So I'll show you the before and after photos, but if you can just have a look at the face, it's actually a lot slimmer. The primary aim, obviously, Rochelle, was not actually to slim down your face, but to decrease your...
Yeah, I was getting a lot of lockjaw, so it's really helped with that, and soreness from my jaw, so it's really relaxed.
Cool.
As well.
So you see, from a medical point of view, we've succeeded, but also from a cosmetic point of view, do you think you look slimmer in your face?
Definitely. I can definitely notice the difference.
Cool. So that's what we're aiming at from a cosmetic point of view. So you see, Botox in this area has, like I said, many advantages. Slimmer face, nicer looking face, V-shaped face, that's the first thing, cosmetic. Secondly, decreased teeth grinding, decreased TMJ dysfunction, decreased pain, and also it can, for some patients, also help decrease headaches as well. So guys, it's a really simple procedure. She has got some asymmetry, which I'll correct at a later stage, and we've got to maintain this every, realistically, 4 to 6 months or so. Thanks for that. So this is the before and after for Rochelle. Note the before, she's got a very square jawline with strong masseters, a very chiseled look, and look at the afters. So what we've done is that we've softened her masseters, her jawline, and she looks so much slimmer. So it gives a more feminine look. This trend first started in Korea much over a decade ago. However, since then has spread to involve most of the Western world. If you can see, the angles of beauty are the same for culture to culture. Basically what we want is a very tapered chin, high cheekbones. Look, as a bias, most of my patients who go for this kind of look are actually Asian patients because of the actual culture. So you can see the massive difference when it comes to facial slimming in Asian patients. This is a subtle change, but sometimes you can have a more dramatic change together with a little bit of fillers to enhance the cheekbones and also point the chin. Now my fourth indication is one which I don't do personally. The reason why I don't do it is because I've had it done to me before, and it's called this. See that? It's called gummy smile. So how do I stop a gummy smile? I smile like this, not like this. Treating Botox for gummy smiles can actually work really well. However, this is the truth, even in the best of hands, side effects occur in about 5 to 10% of cases, and that's transient muscle weakness of the upper lip. So do I like to dribble or lift when I for about 4 or 5 days because I've had Botox? The answer is no, I don't. So that's why I don't do it to patients, because I've had it done myself. And you do get some transient muscle weakness. It's not too bad because your muscles recruit. However, yes, if you're hypersensitive to it, even with the best placement, you can get some side effects. So I don't like to use it for treating gummy smiles, okay? So, but yeah, if your doctor's good at it, and if you don't mind that transient muscle weakness, certainly go for it. So this is an advanced procedure for botulinum toxin because we're dealing with what's called as Botox of the lower face. There are lots of muscles over there, zygomaticus major, zygomaticus minor, rosaurus. All of these muscles actually help you animate, but also these are muscles of action when it comes to smiling. and also basically activities of daily living such as drinking and eating. So the accuracy has got to be there. It's got to be pinpoint accurate as to where these injections are placed. But like I said, even in the best of hands, side effects can occur in about 10% of cases. And I personally don't like doing these injections because, look, if I do 10 patients, one of them will have side effects which may last for up to 3 months. I certainly had that side effect, and like I said, with recruitment of muscles, it does go away. This is also good if you look at the if you put micro Botox along the border of the upper lip. It's very painful, but so I use local for this, but that can help dynamic wrinkling of the upper lip as well. So once again, it can be used. It's called micro Botox to the vermilion border. I do use it occasionally to treat dynamic lines, or so in other words, lines that are present with speech, but once again, not my favorite procedure. But in the correct hands and the correct procedure, we can get some really good results with Gummy Smile. I personally, like I said, choose to retrain my muscles, and I encourage patients to retrain their muscles rather than actually injecting that area. So once again, extended use of Botox, advanced procedure. So guys, the fifth off-label use of Botox is probably one of my favorites, and that's to use it for stroke correction and also Bell's palsy. So these are medical conditions, and with stroke correction and Bell's palsy, it's basically muscle activity in one side which is stronger compared to the weaker side. So what I do is that I use Botox to weaken the stronger side to give a little bit of symmetry. That's all we're doing. It's a very simple procedure, and it makes all that difference, and it really does change patients' lives. So those are 5 medical applications of Botox. Well, this is one of my favorite extended use of Botox. It's basically to treat Bell's palsy. So if you can see, when she wrinkles up, the side which is not affected has movement, but the right side, her right side, is paralyzed. Her left side is dynamic or normal. So basically, we're performing much the same as cosmetic Botox. What we're doing is relaxing the stronger side to compensate for the asymmetry. So tiny units of Botox into the frontalis muscle. Once again, just maybe 2 units over there in each injection site, and that can help reduce the dynamic forehead wrinkles. And every time she looks up, it's more or less symmetrical. So once again, we're thinking outside the box, and we are treating the normal side to compensate for the abnormal paralyzed side. So certainly with the abnormal paralyzed side, we can balance things out as well, and that gives a more aesthetic and pleasing look. So for Bell's palsy and stroke correction, I do use Botox and fillers, and it's one of my favorite procedures because it is life-changing. And you can see she's got a hyperactive platysma band. So when you go E, you can actually see that platysma there. That platysma muscle is overactive on that side. So once again, it's about 6 to 8 units of Botox into the platysma itself. So if you inject the platysma muscle, you can actually decrease the pulling down of that muscle in the neck, and we can give what's known as a Nefertiti neck lift. So I've done a video on this, and if you can click up on there, you can see how I actually perform this procedure for neck lifting or platysma band release. And once again, a very easy procedure, but your placement of Botox has got to be very accurate as well. So that is, that's a platysma band. You can go E, and you can actually see how strong that is. So that's to correct the asymmetrical side. Now, if we look at the side when she smiles, you can see this asymmetry because she's got a more powerful zygomaticus major. And once again, using precise injection points, we can actually relax the muscles on the more powerful side, so on the normal side, so that when she smiles, there'll be less asymmetry. We cannot correct the side of Bell's palsy, but we can correct the other side. At the end of the day, this will give her a more aesthetic, a more pleasing look, and like I said, one of my favorite procedures because it really does change people's lives. Sometimes for Bell's palsy as well, I'll use fillers on the affected side to give a lift as well. So I combine both Botox and fillers to actually help these patients. Possibly do about 2 to 3 per week, and like I said, really good procedure. Hey guys, thanks very much for watching this short video on extended uses of Botox. I can go on for a lot longer. We can talk about Botox for bunny lines, Botox for relaxation of the chin, Botox for even a neck lift called, see these muscles here? Platysma. So I've done a video on that. Click up there and you can see it. So we can go on forever in regards to extended uses of Botox, but these are just my 5 for the week. So hey, thanks very much for watching this video, and remember to subscribe for more info. So 1 new video every Saturday morning. I'll see you next week. Actually, next week I'll be in Prague. So hey, it's a summit conference in Prague. So all the big names will be there. I'll be the smallest fish. All the guys are like the world leaders for aesthetic medicine will be there. And I might see whether I can sneak a camera in to show you guys what really goes on behind closed doors in a summit meeting. So yeah, hope to do that unless we get caught. Bye. Guys, look, thanks very much for watching this rather long video. I try to do educational videos, and I would love you to subscribe for more information. I post a video up every Saturday, Brisbane time in Australia. The other thing as well is that I am on Instagram, so I try to post maybe 2 or 3 videos a week. So if you're really bored and you want to learn something new, follow me on Instagram. Once again, thanks for watching this video, and remember to subscribe for more information. Thanks, bye.